Good morning, I am Cassandra Andriana Martinez, a student nurse from Pamantasan ng Lungsod ng Marikina. And for today's procedure, I am going to do or perform the breastfeeding. I will show you the basic techniques in breastfeeding. Breastfeeding is very important, especially for first-time moms, because the milk of the mother is sterile and ready to use, and um, it is our rule in the country that babies that are newborn should not use any other milk beside the breast milk from the mother. So uh, this is the common problem in first-time moms because they don't know the proper positioning and attachment of the baby. That's why today I'm going to show you the proper positioning and attachment of the baby during breastfeeding. 2, 3. So, before doing the procedure, we must perform hand hygiene and other infection control procedure to avoid any cross contamination. And of course, the mother should also perform hand washing and observe other infection control procedure before breastfeeding. Next is, we are going to provide privacy by drawing the curtains, closing the doors, and providing necessary blankets if it is necessary. And then you should prepare the room temperature in breastfeeding. We can close the doors and the windows for comfortable temperature. This according to it depends with the mother. Next is, after doing the procedure, upon knocking on the door of the client, you must introduce yourself and tell her what you're going to do by saying that you are going to teach him or her the proper positioning or attachment of the baby for breastfeeding. Next is, after providing hand hygiene and infection control, we are now going to start the breastfeeding. So in breastfeeding, there are various types of positioning. So in sitting position, we have the cradle hold, the football hold, the transverse hold, and we also have the side lying position. So when you lie down, so first we must provide a comfortable chair for the mother and a footstool like this. It's a footstool, and then we have the pillows to make the baby we should have pillow on our lap so that it will serve as a support to the baby and for comfortability. So I'm going to show you first how to hold the baby. So this is our baby. So in holding the baby, we should hold the baby. The head and the body of the baby should be in a straight line like that. The neck and the head should not be twisted. And then we are going to put the baby as close as to the mother as possible. So the nose should be the baby's face is facing the breast, and the nose should be in opposite of the nipple like this. So like that. And then hold the babies as close to the mother, and then we are going to support it's very important to support the baby's head, the body, the back, and the bottom, especially for newborn babies. So now, how to support the baby for the breast. So we are going to show you that the mother's fingers should put underneath the breast. The thumb will hold the breast, while the forefingers will be underneath the breast. Make sure that it is not getting in the areola. So uh, here, that. This is how we do it. So if you are going to nurse using your left breast, you should support the baby with your left hand, and the other hand hold your breast, and later on will be the support for the baby's head. So like that. That is how you support your breast. Now, in the putting the latch on, baby's latch on, um, first is, while supporting this, you should know that uh, you should let your breast touch the baby's lips until it is wide open, like that. Okay, and always remember that uh, always remember so the baby should be slightly extended, so that the nipples the aim of the nipples is in the roof of the baby's mouth, like that. And then using your hand, the fingers and the thumb will support the head of the baby, like that. And then slightly extended, and make sure that the mother should not bring the breast to the baby, but bring the baby to the breast, so like that. So after you make your nipples touch the baby's mouth and it is widely open, okay, now going to support now the body and the bottom of the baby. That is the basic positioning of uh, the baby during breastfeeding. So now I'm going to show you the two ways of burping, because the baby go. So it is very important that the baby should burp a couple of times, because the baby do not have too much air, so swallowing too much air. So we have the two ways of burping. So here's the towel, going to put it the shoulder, that. So here's our baby. So we're going to put the baby, position the baby upright. It's like that. Okay. Make sure that the hands will not go within. And then slightly, we're going to use as a support the head, and then we can rub the baby's back and gently pat it. That is the first way. And the second way is we're going to put the baby in sitting position, not a very sitting position, slightly sitting position. And then using our hands, we are going to support the neck and chest of the baby like this. And then using your left hand, we're going to slightly pat the baby's back, and or while rubbing it, like that. That is how we perform show the two burping ways. So after doing I've already teach you the two burping ways. So after that, the mother should perform hand hygiene and observe infection control procedure, and also the healthcare personnel should, or the nurse should also perform hand washing and document that the procedure is done. That is the proper way of breastfeeding. So thank you for watching.